Welcome to the next generation technological solutions in healthcare. Our facilitator is Dr. Matthew Leotine. He's vice president at BLR Research, where he's a sought-after management consultant. He's also a professor at the University of Illinois at Chicago. Welcome, Matt.
Hello, Gene.
So I'm really interested in getting into theme number 6 here. This is a lot of meat on the bone here. Using IoT to enhance financial and payment processes in healthcare. Now, we don't always think about IoT for payment processes. What are we going to learn today?
Well, throughout our whole discussion here in this topic, we were trying to focus on how technologies could be used to improve not only healthcare services, but also the banking and financial side of those services. And so here with IoT, Internet of Things, we wanted to see what are some of the use cases, either existing or potential, that illustrate the use of IoT in conjunction with healthcare payment and financial services. We wanted to explore what capabilities, not only technological, but also managerial in nature or organizational in nature, which capabilities are needed to leverage the data and information that's collected using an IoT interface, and how they can be used in conjunction with financing and using that information to enhance the processing of payments.
And your great panel of experts here run the gamut from IT and tech all the way into life sciences, right?
Yes, exactly. As always, we have a team of panelists here who represent the fields of IT. We have medical practitioners, capital investment managers, and people who've worked in the healthcare industry. So they provided a really well-balanced view on this topic.
And let's get into it here. In your executive summary, it's like IoT and telemedicine had a baby, right? And that's what's happening. What's going on?
Yeah, well, telemedicine was viewed by the panel as one of the first and foremost applications of IoT. But the idea here is that through IoT, you can then capture information from all these various sources and devices that we'll talk about, and then use that information in the most effective ways. Part of it is to reduce costs, but the other part of it is maybe look at it as an opportunity for develop new patient and business models for service delivery. And of course, with this, there are many challenges that we talked about, not only technological, but primarily dealing with how that information is used from a legal perspective, and also trying to preserve the privacy and security of that information.
Let's get into key point 1, right? We've got telemedicine, IoT coming together. Boy, this would be just amazing, right? Everything could get taken care of in nano time, right?
Yeah, exactly. Well, IoT, it provides a big opportunity to boost the capabilities of telemedicine, because then you can avoid the need and the cost of patients physically meeting with the doctors or the practitioners, and that can reduce the lead time for treatment, particularly for those patients that are hard to reach or are confined in some way. And right here, you can see that there's now some opportunity for new types of medical services and how they can be delivered remotely to patients versus inside the medical office. So this opens up the gates for enormous opportunities in terms of service delivery.
Let's move into key point number 2 then. This is the data being delivered directly from various devices, which of course taps into the IoT, right? Because data is coming from everywhere, right?
Right. Most interactions with the healthcare system happens through devices. And there's so many different types of medical devices. And with the IoT, one of the features of the technology is to see if you can digitally represent or virtually represent these devices inside software. So there's enormous opportunity here to streamline and improve data entry directly from the device without having it intercepted by manual entry. And so here what we're looking at is perhaps when some data is being collected and a medical event occurs through the IoT interface, that information then can be delivered to the people who are responsible for generating the payment for that particular service.
And in key point number 2, you talked about some new business models that could come from this marriage of IoT and telemedicine. What did you guys discover?
There's an enormous opportunity now for patients to work with providers across multiple health systems. And, as these devices become more connected, providers can be kept appraised of a patient's progress in real time. And then underwriters can have access to this information, which was previously unavailable. Then they could have more information regarding a patient's lifestyle, which can then enable them, the insurers, to personalize different policies for that particular person. And this opens the doors for new types of services. And also, such information could be used to notify payers on how to get the correct members enrolled in prevention programs as well. So there's an enormous space here for new types of services like we just talked about.
So key point number 4, this is the scary thing, right? This is because with all this data, now we talk about security, we talk about privacy, we talk about breach. How much of an issue is that? Is this slowing down the introduction of more of this telemedicine and IoT?
Well, let's put it this way. It does represent a lot of challenges and hurdles from the legal and regulatory aspect, and as well as the security and privacy aspect as well. From the legal and regulatory standpoint, there are compliance standards are still vague, and both legislation and case law are relatively sparse. Another key concern is security and privacy, and the fact that if you're going to be pulling data from low-level devices, the manufacturers need to have these devices hardened to protect against any kind of cyber vulnerabilities. And this becomes an issue when the data is used to provide or deny care. So there needs to be some infrastructure that it needs to be put in place to not only hinder the misuse of this data, but also to ensure that the data is stored and collected in a secure and private fashion.
Yeah, that's so powerful. So let's talk about these top 3 experts that contributed on this particular topic.
Yes, well, our 3 experts here, they really produced a lot of good content, a lot of great ideas and concepts that we used for this particular theme. And so, we really appreciate their input and participation in this particular theme.
And you did a great job of moderating this. I really appreciate you taking care of this and leading us through this data and helping us better understand it. Again, that's Dr. Matthew Liatin. He's Vice President at BLR Research, where he is a sought-after management consultant. He's also a professor at the University of Illinois at Chicago. And Matt, we will talk again.
Thank you, Gene.